I thank them every day that I'm still here for my kids and still here for my family, because yeah, it's scary when you go through it because you just don't know. My name is Christy. I am 52. I am from Grimshaw, Alberta originally. I have a twin sister. Her name is Misty. She's the one who originally found our triple negative breast cancer. She found it when she was 37. Then once they found out she had it, I ended up starting screening. Then in 2014, I got referred to Dr. Dabbs first. So I went to her clinic. I had cysts. So she did a biopsy of the cyst. Everything was okay, but then she saw my sister's history and she's like, oh, you should get referred to the Hereditary clinic. So in 2014, I started going to the Hereditary clinic at the Lois Hole Hospital.
The clinic was formed to try and provide some advice and screening for women who are at high risk of breast and ovarian cancer. So my role is to see women when they first come and discuss what we think is their risk, give them advice regarding the value of genetic testing, and then we see them once a year in follow-up if they are high risk, and screen them at that time.
We did that until 2021. August, I had my MRI done, and that was on Monday, and then by Friday, Dr. Dabbs had called me and said, we saw something. So we got the biopsy done, and then it came back and it was triple negative breast cancer, just like my sister. Same breast, almost the same spot, which is kind of strange. We did genetic testing, but it never came back conclusive, but it could be a gene that's not even discovered yet. I had a wonderful surgeon. His name was Dr. Peiris. He wanted me to do the lumpectomy, and then when I told him my feelings, and he was like, okay, this is what we can do. This is what I can offer you at this point.
She was still in her 40s with a first-degree relative with a breast cancer, and so we had to regard her as being higher risk for developing a future second breast cancer, and so that's why we went down the road we did with her surgery. Generally, the advice for patients who don't have a genetic mutation is they really do not have to have a bilateral or double mastectomy. Most surgeons would say, well, with or without a double mastectomy, her long-term survival would have been the same. If we're taking a patient-centered approach and we're really talking her through what her own personal individual anxieties are, and we can offer her a surgery which actually is sympathetic to those anxieties, and I think that's a job well done.
I can't speak enough to the value of genetic testing in this patient group. A lot of women overestimate their risk of breast cancer, and only 5 to 10% of breast cancer is actually hereditary. And most women think that their breast cancer or their family's breast cancer is hereditary. So genetic testing does two things. It allays the anxiety of people who are at high risk, but actually they aren't. Having genetic testing and knowing your risk allows you to do things about it.
So having a clinic like this is extremely valuable because it helps us to identify these patients early, helps us to screen them more frequently, and therefore helps us to treat them before they are diagnosed with a breast cancer, and therefore give them a much better long-term prognosis.
Do you examine your breast monthly?
No, I'm afraid I don't.
Well, it's very important that you examine your breasts every month.
In the 1950s and 1960s, the 5-year survival for breast cancer was only 50%. And so it was awful. 1 in 2 women would pass away sadly within the first 5 years of their diagnosis. In 2024, the 5-year survival for breast cancer is over 85%. So I reassure most of my patients that 9 times out of 10, they will survive not only 5 years, but far longer because the long-term prognosis is so much better. Now, the reasons for that are multifactorial, but early detection, And clinics such as the Allard HBOC clinic, where we can see these patients, screen them, and identify high-risk patients, certainly is instrumental in improving long-term prognosis.
I'm very thankful for all the people out there that are able to donate to a cause like this, because if there wasn't these people, I don't know where these programs would be.
The clinic operates virtually entirely on donor funds. Without the donations, the clinic would close. We just would not be able to go forward. I cannot emphasize how much the donations are beneficial and how grateful we are for the donors who do give us money.